For English. I will come here. First of all, dear Joao, thank you for the invitation. It's a great honor for me being here. I have to go as fast as possible because 10 o'clock starts in our parliament the second round of our presidential election. So I have to be there. But I couldn't miss the opportunity to address to you here today. And sorry for the change of the schedule and the time. Ms. President of O.H.P., General Director, Secretary General of the Union of the Patients, Director of the first IPE, of the fourth IPE now, of the third IPE, of the fifth IPE, of the sixth IPE. Okay, they're almost all here. Directors from the hospitals, from MECAPT, General Director, Mr. Miranthea, the President of the Nursing School of Athens, our university. My friend John, one of the best experts we have in the country. Ladies and gentlemen, the president of the Society Against the Cancer and a great donor of our national system of health. Ladies and gentlemen, Socrates said, I care more for the opinion of one person if he's an expert than of 1,000 people that they don't know what they speak about. This is the reason that in my first term as Minister of Health, 10 years ago, 11 years ago now, I decided to start a very strong cooperation with WHO. Until then, the cooperation between the Greek Republic and WHO was on a very low level. It was then that I first met Hans Kluge, who is still a very good friend of mine, and I used the expertise of WHO to persuade, at that period, the super famous Troika to accept my law for the universal coverage of the uninsured people in our healthcare system. The main argument I used to this guy from IMF named Thompson was that WHO will accuse Troika if they wouldn't let this law to pass from our parliament. And this is how I managed to take their license to get in the parliament and vote this law in 2014 on March. And I'm very proud still that this has happened, and Greece is one of the few countries in the world that has implemented the universal access to our healthcare system beyond any criteria, social, racial, financial, or whatever. We have always to remember that beyond our differences, we all remain human beings. And the change of fate can happen to anybody of us anytime. When I became Minister of Development and Investment, I had the opportunity to accept a proposal from WHO to establish this quality of healthcare office in Greece and give to WHO the funding through the Ministry of Health to start examining our system and giving us, through his experts, a real concrete national plan about what we can really achieve, where we really stand, what we can do, and where we can get in a small period of time if we implement the measures that are needed to be implemented. I'm very happy that during the term of my predecessors, Mr. Kikilis and Mr. Plevris, ODP was established. And from the Ministry of Health, we have a national authority that has our experts that can collaborate with WHO in order to make this plan not only to be written and be announced in a conference as the President's today. I welcome the Secretary General of the Ministry of Health. We have many Secretary General, but she's the Secretary of General. This is the difference. Okay. So my ambition is not just to have a plan to say we have a plan, but to find a way to implement the plan and having our patients to experience the high quality healthcare services that they deserve and we can offer them. This is the reason we are here today, and this is a very important milestone in this effort. And I want to thank you, dear Joao, and all your staff in WHO office in Athens and quality of care, because as I told you before, we cannot do these reforms alone. No country can do these reforms alone. We have to have the experience of other countries. We have to learn from their mistakes, from their right choices, save time and money, and beyond all, save human lives. So you permit me now to read the official speech. I'm not very good in reading speeches. It's not my favorite, but sometimes it's needed in official occasions as today's. Ladies and gentlemen, distinguished colleagues, esteemed partners and friends, it is a privilege to present today a defining initiative for our nation. This is National Strategy for Quality of Care and Patient Safety 2025-2030. This strategy marks a transformative step in ensuring safe, effective, equitable, and patient-centered healthcare for all. For the first time, Greece has developed a comprehensive national plan to elevate the quality and safety of healthcare services. This effort was made possible through the exceptional collaboration of the WHO Regional Office for Europe, the WHO Athens Quality of Care Office, the Ministry of Health, the Agency for Quality Assurance in Health, P.O.H.I, I will tell it from now, and DG Reform under the EU's HQC2 Greece projects, which has been instrumental in this process. Greece, like many nations, faces critical challenges: rising health inequities, aging populations, and a growing burden of chronic diseases. Despite notable progress, such as hospital upgrades, the establishment of ODP, and advances in digital health, key obstacles remain. Unmet medical needs exceed the European average. Public confidence in healthcare remains low. Limited health literacy impacts individuals' ability to manage their health effectively. This strategy directly tackles these challenges, ensuring that high-quality healthcare becomes a fundamental right, not a mere aspiration, and focusing on rebuilding the trust that is vital for our care system's success. It's not just a policy, it's a promise. It promises to ensure that every person in Greece has access to safe, high-quality healthcare, support our healthcare providers as they deliver excellence, and create a system that we can all take pride in. This is why we developed the National Strategy for Quality of Care and Patient Safety 2025-2030. It's a bold and ambitious plan, but it's also grounded in hope, collaboration, and a deep commitment to our citizens. Our strategy is built on three guiding pillars: leadership and governance, evidence and innovation, literacy and engagement. We have a solid roadmap for success with 11 clear objectives and 47 target actions. This sustainable and phased approach is designed to bring measurable improvements to patient safety, clinical standards, and public engagement. But this journey is not one we can take alone. I want to thank DG Reform and all our partners for their unwavering support. Together, with your expertise, guidance, and resources, we will position Greece as a leader in healthcare quality and patient safety. As the World Health Organization reminds us, there is no universal health coverage without patient safety and quality of care. For Greece, this means more than just preventing harm. It means restoring trust, strengthening our communities, and fostering a sense of hope and pride in our healthcare system. I invite each of you, government officials, healthcare professionals, and community leaders, to join us in this mission. Together we can ensure that every patient feels secure, valued, and cared for. Equip our healthcare professionals to deliver the highest standards of care. Build a healthcare system that reflects the Greek people's values, resilience, and spirit. The national strategy for quality of care and patient safety is not just about improving healthcare. It's about building a healthier, fairer, and brighter future for all of us. With the steadfast support of our national and international partners, I am confident that we will succeed. We are making a huge step, but more work and dedication is needed. The implementation begins now. We will continue to seek additional support from the European Commission and DG Reform to ensure this strategy's success and make measurable, lasting improvements. This is what we promise to the Greek people, and this is what we will deliver to the Greek people. Thank you very much.